Obesity is a global problem and is hitting Singapore hard. In 2022, nearly 12 out of every 100 adults here were obese, double the rate from 30 years ago. What's behind the surge and how is Singapore fighting back? Nicolas talks to a senior consultant to uncover the risks and solutions, tackling obesity one person at a time.
Obesity. It's no longer just a global problem, it's personal and it's here. And in Singapore, the weight of the issue is growing. From the latest data, for every 100 Singaporeans aged 18 to 74, almost 12 were obese. That was in 2022. 3 decades before, in 1992, just over 5 out of 100 would have been obese. So how did we get here, and what can we do about it?
What are the general trends you observe with this disease?
Between 2010 and 2022, which is our last statistics, we've hovered around anywhere from 10+% to currently of 11.6%. The rates, however, are gradually rising. But I think if the measures had not been put in, we could have seen a larger rise.
The stats define obesity as a BMI of 30 or above. That's the WHO standard. But for Asians, trouble starts earlier, at a BMI of just 27.5, thanks to their genetics. In 2022, that's nearly 1 in 4 Singaporeans aged 18 to 74, some 22.3%. That's almost double the rate. And it's not just about looks or waistlines. It's about what that fat is doing inside their bodies.
It's not just about weight. It's not just about having excess fat. It's really, going into a pathological state, a disease state, where now the excess fat, or adiposity is what we call it scientifically, is causing health problems.
When you say that someone is obese, what's really happening inside their body?
Sure. So actually, when we sort of have excess energy, so it's actually very basic. It's actually an energy balance state, and it's when we end up having more energy than we consume. That energy has to go somewhere. So when that fat cells start to extend and unable to tolerate more fat storage, then the fat needs to also flow somewhere else, needs to be stored.
That somewhere else is the real danger. Fat starts piling up where it shouldn't, in the liver, around the heart, even in your muscles.
They're naturally not supposed to be there. And when they're there, they start to invoke things like inflammatory responses. And that actually spills over to ill health. And then all the crosstalk that leads to increased risk of heart disease, stroke, type 2 diabetes, and even what we call MASLD or fatty liver is what people call it.
And the effects aren't just medical. They're deeply personal.
Our patients in our hospital has reported, a substantial number, up to 80%, right, are impacted by the weight, whether it's at home doing their housework or, at work or public places.
In fact, obesity is associated with more than 230 medical conditions. And 70% of obese patients seen at Dr. Tham's hospital have at least 4 such conditions.
How does public perception affect the way people approach obesity as a disease?
I think oftentimes they don't view it as serious as chronic diseases such as type 2 diabetes, high blood pressure, cancer, or even heart disease. For obesity, it seems to be different, right? They know it's serious, but they often just seek help on their own. So I don't think everybody needs to go and see a doctor, but I think they need to view it that, obesity can lead to many serious, also chronic diseases on its own.
And here's the twist. Their bodies may be working against them.
Energy regulation is disrupted in obesity. So you may see that people say, I really don't eat much, I'm still putting on weight. And it's true in quite a number of people, right? Because the way they're handling the energy now, the metabolism has changed when they have obesity.
So if your body's rewired to store fat and resist weight loss, what can you do? There are options. And in tougher cases, it takes a full medical team. At minimum, a physician, dietitian, physiotherapist, and psychologist.
We will look into the efforts the patient has made. If the patient has or a person with obesity has tried many, many times, it's really a signal for us to then add on something beyond diet and lifestyle therapies, although that is still basic. So we may then, introduce in things like medications and even including intensive diet dietary interventions.
In more serious cases, doctors may step in to shrink the stomach, one way or another. That could mean surgery to make it smaller, or filling part of it so it holds less. But what about stopping the weight gain before it starts? What's actually working in Singapore to help people stay healthy and keep the kilos off?
So I think to address obesity in Singapore, I think the environment is very, very important. We've seen a lot of infrastructure built around the environment, right? Making healthcare very close to where we live, and making the environment very livable, and also with healthier SG to encourage people to then go to doctors to get health screening and then to assess their weight.
Obesity isn't a flaw or a simple lifestyle choice. It's a complex chronic disease that's often misunderstood and unfairly judged. But with better awareness, proper treatment, and strong support, Singapore can change this story, one person at a time.
Now, if you or someone you know needs help managing weight, talk to your family doctor or visit healthhub.sg.